Okay, we're going to move to our next presenter. This is Dr. Elizabeth Chappell, and she's going to be talking about the incidence of SARS-CoV-2 infection and clinical characteristics in children and young people living with HIV in Europe. Dr. Chappell.
Hi, thank you. Is there a pointer?
I think it's right there. So go down. You're good.
Thank you. So children appear generally less affected by COVID-19 than adults, although severe presentation and MIS-C or PIMS-TS, the multi-system inflammatory syndrome, can occur in a small percentage. And a recent meta-analysis and an analysis of data from the WHO COVID clinical platform demonstrated that HIV was associated with an increased risk of severe disease, of ICU admission, and of death, even after adjustment for key confounders, including age, sex, and comorbidities. And both of these studies included children and young people living with HIV, but of course they only represented a very small proportion of the total numbers, and there were no specific analyses exploring outcomes in this group. And indeed, in general, there are limited data on the incidence of SARS-CoV-2 infection and clinical characteristics and treatment of COVID-19 disease within this pediatric HIV population. Our aim was therefore to assess the incidence of SARS-CoV-2 infection in children and young people living with HIV in our European cohort and to describe the clinical characteristics and outcomes. So the data from this analysis comes from the EPIC cohort collaboration. And EPIC pulls data from pediatric infectious disease cohorts across Europe, and some of these cohorts have national or regional coverage, while others are just based at a single site. And EPIC periodically pulls data from all these cohorts according to a standardized protocol. And one of these data mergers was already planned for 2020, so this was used as an opportunity to collect COVID data on children and young people living with HIV. So the pediatric HIV cohorts were included in this analysis specifically if they had follow-up data available into 2020 and were able to report COVID-19 data. So this meant the inclusion of data from 11 cohorts from 9 countries, as shown on the map. So individuals themselves were included in this analysis if they had been diagnosed with HIV and presented to pediatric HIV care less than 18 years of age, and if they were still in follow-up aged less than 25 years of age as of the 1st of January 2020. When calculating rates, so the follow-up time, this began on the 1st of January 2020 or on the date of birth or a first presentation to care for those who were diagnosed or presented to care after this. And individuals were followed until either they had a SARS-CoV-2 infection, until they died, until they reached 25 years of age, or until their last visit before data censoring. And the date of this data censoring varied by cohort between March 2020 and May 2022. And data from adult care were included where they were available from the cohort. Cases were defined as those having either a positive SARS-CoV-2 PCR test or those who were hospitalized with a presumed COVID-19 diagnosis, although actually all the cases we identified did have a positive PCR test. And we did also ask about data on any children or young people considered to have MIS-C, but actually no such cases were identified. So for anyone meeting this case definition, a case report form based on the one developed by WHO and ASIRIC was circulated to the HIV clinicians to collect additional data on COVID-19. So in total, 1,718 children and young people living with HIV met our inclusion criteria and had follow-up data into 2020. Of these, 129, so 8%, had a confirmed SARS-CoV-2 infection, giving an overall incidence of 47 cases per 1,000 person years. And of the 129, additional clinical data was available for 39, so 30%. This next slide, or this first table, compares demographic and clinical characteristics among the 129 cases with SARS-CoV-2 infection in the first column, compared to the 1,589 individuals who had no confirmed infection in the second column. So there was no difference in terms of sex or ethnicity or mode of HIV acquisition. Then comparing characteristics between the two groups as of the 1st of January 2020. On average, those who had a SARS-CoV-2 infection were slightly older than those who did not, and correspondingly had a longer time since HIV diagnosis. And also those with the SARS-CoV-2 infection were less likely to be virally suppressed than those who did not have SARS-CoV-2 infection. But there were no difference in terms of CD4 count or levels of obesity. And then this second table summarizes characteristics at the time of SARS-CoV-2 infection among those where the date of infection was known. So the vast majority of cases were on ART at the time of diagnosis, but 4 children were experiencing a treatment interruption at the time, and 1 of the children was ART naive. And then among those where it was available, the reason for having the PCR test for the majority was contact tracing, and some were also identified because they presented symptomatically. So this next slide shows the symptoms. So among the 39 cases where we had additional clinical data, symptom data was unknown or unavailable for 1, but of the rest, 61% were reported to have symptoms. And I show in the figure here what those symptoms were, so in descending order of frequency. And the most common symptoms were cough, fever, and loss of smell. And then we asked the HIV clinicians to report the disease severity according to the WHO classification. So about 40% of the cases were asymptomatic, about half were classified as having mild disease, and then no one was classified as having moderate, severe, or critical disease, although disease severity was unknown for a small number. And then outcomes, so 3 of the cases were hospitalized, and I'll say a little bit more about each of these now. So the first case was a 19-year-old who was admitted to hospital for 3 days. They were suppressed on ART, and their last CD4 count was 352 cells. They were classified as having mild COVID disease and were admitted to hospital mainly because of their anxiety around having been diagnosed with COVID. The second patient was a 6-year-old child who was admitted to hospital for 23 days. They had only recently been diagnosed with HIV and had been on ART for less than 1 month. Their CD4 count was 6 cells, and they had an AIDS diagnosis, so encephalopathy and wasting. Their symptoms included wheezing and an increased respiratory rate. They were classified as having mild COVID disease, and they received several medications while in hospital, including interferon alpha, but did not require oxygen. And then the third patient was 19 years of age and was admitted to hospital for 1 day. They were suppressed on ART, and their last CD4 count was 419 cells. They were classified as having mild COVID disease and did not require any medication or any oxygen while in hospital. And then we also asked about ongoing symptoms. So 1 of the 39 cases was reported to have ongoing symptoms at 6 months after SARS-CoV-2 infection. They are someone who'd had mild COVID disease at the time and were not one of these 3 hospitalized patients, and their main ongoing symptom was fatigue. So this analysis has a number of limitations. Firstly, the additional COVID clinical data was only available for some of the cases. We only included cases where there was a positive PCR test, and only cases known to HIV clinicians would have been included, so it's possible that many asymptomatic cases would have been missed, although we're confident that the most severe cases would have been picked up. Interpreting rates over time is difficult in an analysis like this, where we're pooling data from many countries which would have experienced different waves of the pandemic at different times, so that's why we've not presented these here. And also, unfortunately, no data on vaccination uptake were available because the study started and collection of data began before the rollout of vaccination. So in conclusion, this study represents the first description of SARS-CoV-2 infection and COVID-19 disease among children and young people living with HIV. The incidence of diagnosed SARS-CoV-2 infection was relatively low, but more common in those who were older and were not virally suppressed. And among those with symptoms, none experienced severe disease, and there were few hospitalizations and no deaths, and few were reported to have ongoing symptoms. I'd like to acknowledge all our cohorts who contributed to this analysis, as well as ViiV Healthcare, who funded the study. Thank you.